Hello, and welcome to our channel. Today, we're going to talk about a serious health topic: acute myelogenous leukemia, or AML. This is a type of cancer that affects the blood and bone marrow. It's called acute because it can progress very quickly. Our goal today is to provide clear, understandable information about AML, from what it is to how it's treated. This video is for educational purposes and should not replace advice from a healthcare professional. If you or someone you know is dealing with health concerns, please consult a doctor. So, what exactly is AML? It starts in the bone marrow, which is the soft, spongy tissue inside your bones where new blood cells are made. In AML, the bone marrow produces abnormal myeloblasts, which are a type of immature white blood cell. These abnormal cells are called leukemia cells. They grow rapidly and crowd out healthy blood cells, like red blood cells, white blood cells, and platelets. This is what leads to the symptoms of AML, because your body isn't getting the healthy blood cells it needs to function properly. The symptoms of AML often resemble those of the flu, which can make it tricky to identify at first. You might experience fever, bone pain, and feeling tired or weak all the time. Because AML affects your blood, you might notice you bruise or bleed easily, like frequent nosebleeds or bleeding gums. You might also get infections more often than usual, because your body doesn't have enough healthy white blood cells to fight them off. Some people experience shortness of breath, pale skin, or tiny red spots on the skin called petechiae. Unexplained weight loss and a loss of appetite are also common. It's really important to know when to see a doctor. If you develop any signs or symptoms that worry you and seem persistent, don't wait. Make an appointment with your doctor right away. While these symptoms can be caused by many other less serious conditions, it's always best to get checked out. Early diagnosis is key in managing any health issue, and AML is no exception. A doctor can run the necessary tests to figure out what's going on and get you started on the right path. Now let's talk about the causes. The exact cause of AML isn't fully understood, but scientists know that it happens when a bone marrow cell develops changes or mutations in its DNA. DNA contains the instructions that tell a cell what to do. In AML, these mutations tell the bone marrow cell to keep growing and dividing uncontrollably. The cell produces immature cells called myeloblasts instead of healthy blood cells. These abnormal cells don't function properly and they build up, crowding out the healthy cells your body needs. As you might imagine, AML can lead to several complications. The main issue is that the leukemia cells can overwhelm the bone marrow, making it difficult to produce healthy cells. This can lead to serious anemia from a lack of red blood cells, life-threatening infections from a lack of white blood cells, and severe bleeding from a lack of platelets. The cancer can also spread or metastasize to other parts of the body, such as the central nervous system, skin, and gums. The treatments for AML can also have significant side effects, which we'll discuss a bit later. There are certain risk factors that can increase a person's chance of developing AML. It's important to remember that having a risk factor doesn't mean you will get the disease. AML becomes more common as people get older, with the average age of diagnosis being around 68. Men are slightly more likely to develop AML than women. Previous cancer treatment, such as certain types of chemotherapy and radiation therapy, can increase the risk. Exposure to certain chemicals like benzene is a known risk factor. Smoking also significantly increases your risk. Lastly, some blood disorders like myelodysplasia and certain genetic syndromes like Down syndrome are associated with a higher risk of AML. So how is AML diagnosed? If your doctor suspects leukemia, they'll start with a physical exam and ask about your symptoms. The main tests for diagnosing AML are blood tests and a bone marrow biopsy. Blood tests, like a complete blood count, can show if you have abnormal levels of red blood cells, white blood cells, or platelets. They can also detect the presence of blast cells. A bone marrow biopsy and aspiration is the definitive test. A doctor uses a needle to take a small sample of bone marrow, usually from the back of your hip bone. This sample is then examined in a lab to look for leukemia cells and identify the specific subtype of AML, which is crucial for determining the best treatment plan. When it comes to treatment, the main goal is to destroy the leukemia cells and allow the bone marrow to start making healthy cells again. This is called achieving remission. The primary treatment for AML is chemotherapy. This usually happens in two phases. The first is induction therapy, which is an intense phase of chemo given in the hospital to kill as many leukemia cells as possible. The goal is to get the blood counts back to normal. The second phase is consolidation therapy. This is given after remission is achieved to kill any remaining leukemia cells and prevent the cancer from coming back. This might involve more chemotherapy or a stem cell transplant. A stem cell transplant, also known as a bone marrow transplant, is a procedure to replace your diseased bone marrow with healthy stem cells. These healthy cells can come from a compatible donor, which is called an allogeneic transplant, or sometimes your own cells can be collected and used later, which is an autologous transplant. For AML, an allogeneic transplant is more common. This is a very intensive treatment and is usually considered for younger, healthier patients or for those with high-risk AML. Besides chemotherapy, there are also targeted therapies. These are newer drugs that attack specific vulnerabilities in cancer cells. For example, if the leukemia cells have a specific gene mutation, there might be a drug that targets that mutation. These therapies can be used alone or in combination with chemotherapy, and they often have different side effects. Your oncology team will determine the best course of treatment based on your specific type of AML, your overall health, and your age. Some people explore alternative medicine. It's important to be clear that no alternative treatments have been proven to cure AML. However, some complementary therapies might help you cope with the side effects of cancer and its treatment. Things like acupuncture, massage, meditation, and yoga may help reduce fatigue, nausea, and stress. Always talk to your doctor before trying any complementary therapy to make sure it's safe and won't interfere with your cancer treatment. It's vital that these are used alongside, not instead of, standard medical care. Finally, let's touch on lifestyle and home remedies. Coping with an AML diagnosis and treatment can be incredibly challenging, both physically and emotionally. Taking care of yourself is paramount. Try to eat a healthy diet to keep your strength up, but be aware that treatment might affect your appetite. Sometimes, just eating whatever you can is the best you can do. Get enough rest, as fatigue is a major side effect. Gentle exercise, like short walks, can also help combat fatigue and improve your mood. But listen to your body, and don't overdo it. Beyond the physical, it's crucial to take care of your mental and emotional health. Allow yourself time to process your feelings. It's okay to feel sad, angry, or scared. Connecting with a support system can make a huge difference. This could be friends, family, a support group, or a mental health professional. Talking about your experience can be very helpful. Many cancer centers offer support services for patients and their families. Remember, you don't have to go through this alone. Asking for help is a sign of strength. If you are feeling overwhelmed, please reach out to a mental health professional or a crisis hotline. There is support available. Thank you so much for watching and taking the time to learn about this important topic. We hope this information was helpful and easy to understand. If you found this video valuable, please give it a thumbs up and consider subscribing to our channel for more health content. Stay safe, stay informed, and take care of yourselves and each other.